Hello, hello, hello. Assalamu alaikum. Jianu, Pakhair Ragale, Ni hao, Chunashume, Washmale, Ohio Gonzalez, Guten Morgen, Ola, Bonjour, Previous, Kaifal, and a very amazing Khush Amadi to everybody who's tuned into PT World and are watching World this morning alongside the very pretty Maha
Thank
Makhtoom
you.
and Shazad Khan. Hello, Maha. How are you today?
Hello, Shazad. Assalamu alaikum, everyone. I'm good today. I'm excited about our shows. This is something that we've been, wanting to do for a very long time. So I'm excited when we get shows like that.
And ladies and gentlemen, I think that Maha today is very excited because of the fact that I actually want her to lead the show today because the topic which we have picked up on, I think that she can do justice with
Thank you
that.
so much. No, you can too. But the thing is, whenever he says that you're leading the show, is the show that it's very hard to rein him in, and it's like you have a lot to say. But it's a joint effort. It's about working together side by side because change and sorting out issues will only come when we work together. No.
Exactly. So we've always been working as a team, and today even we will work as a team. But as a matter of fact, this topic which we have picked
Yeah.
up on, all of these issues which we are going to, or which we are about to discuss, hold some very important position in everybody's life.
Absolutely.
And for example, when we talk about increase in population, for example, it is related to that too as well.
Absolutely.
And quite a lot of times what I've witnessed is that people do undermine the importance of knowing how good or how bad you feel when you're in that process.
Exactly. Now, the thing is, we all have, biological organs, we all, work in a certain way, and there's nothing that can ever stop it. There are certain things that happen to men, certain things that happen to women, and even within, within our religion, depending what religion you guys follow as well, is that education and knowledge is key. Being ignorant about something in the era of information and in technology is not an excuse. And when even you're emphasized and encouraged to look after yourself, then to not give adequate attention to it is wrong.
And I think it is very important for us to look after each other and then our own selves as well, because if you're not going to love your own self, nobody else will. So let's just jump onto the topic. Mahal, what are we talking about
So
today?
today we're going to be focusing on women, and I know you love doing that as well. And the thing is, we're going to try and keep it as emotionally balanced as possible, because sometimes I get really worked up on certain issues because it just gets a bit frustrating. But no, today we're going to be in the first segment. We're going to be focusing on women gynecological issues. What do they need to know? What are the main issues that they go through, especially as teenagers or young adults? Because at one point or the other, our education system or our knowledge system is not. It's not succeeding in keeping us informed.
Exactly, and thank you very much for saying that, Mahar, too, as well, because nobody in my school days or college days actually told me that, what happens or what does not really happen or how am I supposed to look after my own self. And talking about young girls or women, I don't think that they have adequate knowledge of, what processes they're going to pass from through
Exactly.
their life, for example, because over here in Pakistan, we do have this sentiment of getting married at a very young age as well, and then dealing with pregnancy and then postpartum depression too as well. All of these things. We don't even talk about these issues, and we think that, okay, if you're going to talk about these issues with our daughters, that's going to be a bit of shame. Well, there's no shame. We are doing it and we're setting the trend.
Exactly. And and like Shazad mentioned, that the fact that we don't know about these things is just, it's a crime. And it's natural. It's going to happen. There's nothing to be embarrassed about. It's just life. So, to discuss all of this and the beauty of life as well. There's a lot of, it's very complicated and complex situations. So we've been joined by a wonderful guest, and Shazad is going to do our introduction.
And on my right-hand side, our wonderful guest, who's actually Mother and Child Health Center, PIMS Islamabad. He's the head of Unit 2. She's none other than Professor Dr. Nasira Tasneem. Hello, ma'am. Assalamu alaikum. How are you?
Hello, thank you very much
Walaikum
for
assalam.
inviting again.
Thank you so much for being here. It's always a pleasure to have you on the show. But it's a very important topic. There are a lot of gynecological issues that women go through, which they are not aware about.
So, Ma, what issues have we picked up on? What issues are we discussing
Okay,
today?
so we have picked up on 5, and we've already done shows on some of them, which she also did while I was away, which was great. But so we'll start from the first one. So we'll be going through dysmenorrhea.
Yeah.
That's how you pronounce it. And the names are really tough. Then we have ovarian cysts, and then we have endometriosis. Then we have polycystic ovarian diseases, and we have UTI, urinary tract infection. So we're going to try and get through all of them for you guys. So let's start with number 1, Dysmenorrhea. Is that
Yeah,
it?
dysmenorrhia. Yeah.
Dysmenorrhea.
I'm really glad that you have started talking about the topics which were always a stigma, and even we had a chapter in the book and nobody would ever talk about it.
They would
The
skip the
teachers,
chapter.
yeah, they would say, yeah, they would skip the chapter, and even the teacher was never comfortable in talking about it.
Right.
So I think this is the best forum where we can talk about dysmenorrhea. Per se is a condition where the women usually happening more in the young girls.
Okay.
Cyclically, once they start bleeding, and with the menstrual cycle, they start getting pain as well. So now they have to manage two things: pain and the bleeding. So it's for some girls, it's so much devastating that they have to skip the schools, they have to be on leave, and they get vomiting associated symptom. And for them, coming of the period is like a hell, because every time they have to go through the same things.
Right. Okay.
Well, what are the causes of this disease?
So in many of the cases, it's we usually call them as a primary dysmenorrhea, where from the start of the cycle, the moment they have started of their menarche, the things would start. They would come up, and then there are those who were initially having a normal cycle without any pain, and now it is coming after 1 year, 2 years.
Okay.
So the causes are different from them.
Okay, but I think we're using the terms very broadly because I think a lot of women go through pain during this time of the month. So tell us exactly what is it, because there is a difference in the type of pain,
Yeah.
the level of pain, the intensity, everything. So
Yeah.
tell us what it is.
So usually the primary dysmenorrhea occurs in the young girls. Very commonly it does occur, but it should not be very severe enough to cause so much disturbance of the regular cycle.
So it's just pain.
Yeah, it's just pain, and which is relieved by simple measures like a little rest, a little warming, soothing, and that works. But sometimes if it is really disturbing for the women, disturbing for the girl, she has to skip the schools, they must get it investigated.
Okay.
And because the commonest cause which we are seeing these days is this endometriosis, and it's really very, very.
We will get to that, but
yeah.
let's just focus on one issue at a time. Okay, so now the thing is, so the symptoms of dysmenorrhea
Yeah.
is just pain. So
It's just pain.
So, but most girls will, now how does a parent
Yeah.
or a mother tell this is a severe, this is an actual issue, or this is just a little bit less, more of a cramp, and they can go to school? How do parents tell the difference?
A girl, if she is going to school and it's a little disturbing, it's okay. It's a part of the game. But then they can, take some painkillers, and that will work,
You can speak more freely. It's
Yeah.
fine. You don't need to
Okay.
you don't need to
Okay.
censor
but
yourself.
if it's like the pain, especially in the first 2 days, is very much expected. But in the if the pain in the beginning is less and it's worsening as the periods are going on,
Yeah.
this would show that there is underlying pathology which needs to be further investigated.
Okay.
So that is one difference where pathological and a physiological
So
dysmenorrhea
what kind
can
of
come up.
reasons have you seen in different cases?
Like
For example, the causes of this particular disease, when you investigated, were they different with different people? Was it based on their lifestyle, or it was just natural?
Well, we can't really say the lifestyle has do much with it, because dysmenorrhea is something, there are multiple causes. If you talk about some people have got very tight opening, of the uterus through which once the blood starts coming out. Some people have got excessive flow. Because of that, uterus cramps and it pushes it down. Sometimes it's a familial, the mother had it, so the girl is also having it. Some people, they are having a long standing job, so there, the congestion and all that thing. And then if you talk about the pathological, as I said, the endometriosis is one of the commonest. Then the infection, if somebody has got STIs, sexually transmitted infections, they also lead to dysmenorrhea. So, these are the kind of...
Yeah. Okay, sorry, this is because we're laymen's in this, so we're just trying to figure out all the wording. But dysmenorrhea is also known as period cramps and pain. So it's just something that majority of people then go through this. So this is very common.
Yes.
Okay, so now let's move on to the next one, which
Well,
is
what are the solutions for this one?
there's nothing. You stop having your menstrual cycle.
That's it. There's no other medicine. There's no procedure.
Painkiller?
And it's not just a joke. Sometimes you have the answer is in stopping the period. Sometimes, for example, we'll come to endometriosis as you said, but majority of the cases by applying warm packs that helps. Having more rest, having warm baths. You know, the bath was prohibited. It was said, you know, having a bath during periods is really very, very harmful, and the mothers would, you know, stop from doing it. But practically, bath is something which warm bath it does help in relieving
But I
the
think
discomfort.
wearing loose clothes
So-
might help too as well.
Yeah.
Wearing loose clothes might help because you know in these days we wear jeans, you know, tight pajamas
Yes,
and whatnot.
yes.
I think loose
It
clothes
does-
help full stop and everything.
Because you know your abdomen is already tender, and then you wear tight clothes. Obviously,
Okay.
it does help in that way. Yeah.
Okay, so this is a very common one, you know, so it's also known as just, you know, PMS, it's not a pre, it's the... It's
Premenstrual
during.
symptom. That is a
Does that fall
premenstrual.
into-
So sometimes the dysmenorrhea before the period start, they start
You
having.
can have it
yeah, you
before
can
too.
have that.
Okay,
So
wonderful.
sometimes it presents that way as well.
Not
yeah.
wonderful, but, you know, wonderful to have this information.
Yeah.
Okay, so now moving on, let's talk, you guys have done a show on ovarian cysts as well
Yeah.
before. So tell us, what are ovarian cysts and who is more likely to be affected by this?
You see, ovarian cysts there are different kinds of ovarian cysts. It could be a physiological one, the pathological one. Physiological ones mean every girl, every month, you know, an egg formation process occur, and sometime if that egg persists, it does not rupture, then it leads to an ovarian cyst formation, and that's a physiological one. The next month you will not see it.
Okay.
So just looking by ultrasound, you see a cyst, you get excited about it, and young girls they get their ovaries removed by you know untrained, unexperienced people. I would not blame a single person about it, but it's you know your anxiety that you know castrates that girl from the ovary, because you know you just looked at the cyst and you labeled it as pathological and started going for the surgery. So it's not that. You should try to avoid it, get it investigated. Is it a kind of physiological cyst? Is it pathological? And how do you characteristically differentiate between the two? If during the periods, the next periods, if it persists and it's of beyond a certain size, and the size is usually more than 5 centimeters size, you think that it is a pathological one.
Okay,
It needs to be further
I'm
investigated.
very sorry,
yeah.
Bob, since we are definitely laymen in this, but removing the ovary because of the cyst means that you're infertile then?
You know, nature has all the vital, ovary is a very vital organ.
Yeah.
So just like all vital organs, nature has provided two. So if one ovary is removed, now she's left with one ovary. And if, God forbid, if that second ovary is also involved by some reason, then again, then you are absolutely without.
So we
It's
have
not
to-
only that, you know, she's going to be infertile, but in fact, her whole life is ruined because she was totally dependent on the hormones which are keeping her young. So she is now an old age lady of 55
So what we are
years.
trying to share over here is that, you know, if, God forbid, there's a cyst, we have to get it checked whether it's pathological or physiological,
Okay,
Logical,
but
yeah.
and
before...
then move on with
Then
the
move
procedure.
on with it.
Then move on with the procedure. But how? Okay, wait. I'm sorry if you've already said it, but how does one know if they've got a cyst?
How do you know?
I mean, that's the main thing, right? How do we know?
Sometimes they are silent cysts. And, you know, as you were talking about the young girls, so the silent cysts are not really, you know, and it's purely a cystic one. It doesn't have solid component. It is not complex. It's a very nice, you know, and absolutely a bag of water. Nothing to worry about. But if it has got solid components, now your question regarding, you know, the
How do you
silent
know?
cyst, if they are there, they're lying for ages. Nobody knows, and they're not harmful at all. But it's a pathological one which would present with sometime it undergoes torsion. It turns on its, you know, stalk, and then it causes severe pain. Or there's dysmenorrhea, this endometriotic cyst, for example. They have got the chocolate fluid in it, and they are the one which are more notorious. They cause a lot of pain, a lot of dysmenorrhea. The characteristic feature of dysmenorrhea of this endometriotic cyst is in the beginning it's less, but as the periods go on, the severity of pain increases.
Okay, so basically a lot of it's on your pain sensory, like reaction to
Exactly.
everything.
And then what are the treatments of it? Because quite a lot of times I've seen that, you know, whenever there's a cyst, for example, may it be brain or may it be any other organ, I've seen the doctors try treating them with steroids too as well. So are there any other procedures?
I think steroids is not the choice.
Just to
If
shrink them up.
Yeah, no, it's not the right choice.
Okay.
Yes, if a physiological cyst and it's not settling down, and how do we know the physiological cyst which is not settling down is the one which stays there, is a very clear cyst, and its size is not increasing that much. In that particular case, and the mother is now worried, or the girl is having a little pain, but mainly it's the mother's worry now that, you know, cyst is there, the doctor has made her worried. So in that particular case, the oral contraceptive pills, this is something very important to understand, that the oral contraceptive pill, they have additional benefit of regressing these cysts. So it was a physiological one or two cycles of oral contraceptive pills that will resolve the, you know, the physiological ones.
Yeah, but that, I mean, one has to go to a physician because there are lots of side effects and negative adverse effects of these contraceptive pills as well. Okay, excellent. So, I mean, not excellent. Information is excellent. Okay, so now moving on to the end. This is a complicated
It's all right.
topic. Endometriosis.
Yeah.
These are such hard words, guys.
What is
I'm
this?
sorry. So you've mentioned it a
Endometriosis.
few times already. So, and I think both things that we've already
linked.
discussed are linked.
Yeah, we are encountering a lot of cases these days. I don't know why. Is it, you know, mothers are now more concerned, which is a good thing, they are concerned. And dysmenorrhea, which was treated like, you know, without anything. Now they are concerned about that dysmenorrhea, which is not settling down. And the characteristic feature of, they say, what is this endometriosis? There's ectopic endometrium, the similar kind of internal lining of the uterus which was there inside the uterus, that somehow that endometrium gets ectopic, it goes into the pelvic cavity, gets implanted there, and when the girl starts menstruating, the blood which is coming out, the similar kind of blood is, you know, staying inside and it is hiding in the pelvic
That can
cavity.
be
Since it's
dangerous.
a closed, since the pelvic cavity is a closed space, so what happens, that blood gets encysted, it gets a wall around it, and now it becomes an endometriotic cyst. So you will find a typical chocolate fluid into that cyst. So there
Is it something to worry about or not?
it is something to worry
Okay.
about.
Sounds
It is
unpleasant.
something to be treated as well.
Okay.
This is a pathological cyst. And here a certain test, blood test, they can easily tell us the look of the cyst at the ultrasound. That is also going to tell us whether
Okay.
is a simple cyst or is a chocolate cyst.
Who's prone
So-
to this?
So who's prone to it? The young girls are very prone to it these
Young
days.
girls are prone to everything.
But you know, it does happen in the reproductive age. As long as the woman is menstruating, she is liable to have these endometriosis.
I mean, but as in, like, I mean, is there certain genetic factor that could do it? Is there external things that could trigger it off? Like, you know, maybe a certain health, like lifestyle, or, you know, I mean, that's what I mean by prone. Like, do you already have to have it within
get
your
your point.
family?
People are working a lot on endometriosis. They have not yet been able to find out.
Okay.
Genetic factors, they are trying to find out that there are some genes which are directly related to it, but yet we have not found an answer. In fact, recently I encountered a girl whose mother brought her, during her menses, she would bleed from every possible side, from the nose, from the mouth, and she had severe chest pain because the endometriosis can occur anywhere in the body.
Oh, wow.
So she had endometriomas in the lungs as well.
Oh,
So
gosh.
we put her on oral contraceptive pills because we don't recommend that the people would start taking it themselves. Obviously, it's the doctor who
No,
has to
obviously, the
prescribe, yeah,
experts
yeah.
need to tell you what to do. Oh, wow, this sounds really unpleasant. It's just like one thing after another.
It's dangerous.
Absolutely. And so now, endometriosis, and then we have the polycystic ovarian diseases.
Yeah.
So now, these are all linked to the ovarian cyst and dysmenorrhea, and all
That's
of these.
just Oscar?
Like, yeah, it's everything's linked in? Or is there anything new that we would shed?
Sometimes,
Just sometimes figure out if there's anything new.
that's you know, it's very important to understand that the polycystic ovarian disease is not an ovarian cyst.
Okay, so they're
Yeah.
different. Okay.
Yeah,
So good
so-
thing we picked it up.
Yeah, because this creates a lot of anxiety among people when you label them as polycystic ovarian disease, and now there's a lot of discussion going on. Shall we call it a polyfollicular cyst, a polyfollicular ovary, rather than saying then polycystic ovary? Because once you label that polycystic, the patients, they start getting worried. They've got cysts. So it's not. Basically, what happens is a normal cycle. One egg is formed, is you know, the multiple, you know, cohort of eggs which starts growing, but it's the one egg which gets a lead. So that is a normal phenomenon. So if all 9 or 10 eggs, they start taking a lead, so they will form, you know, small 9 mm, 10 mm cysts, which appear on the ultrasound as a necklace of small, water-filled bags, and that will give a feeling of you label it as a polycystic ovarian.
Okay, now
And then how do you treat it?
But but then
How do you
it's
tell you
not
have
only
it, though? I don't
just by
understand.
looking at the ultrasound, a polycystic, it doesn't matter. But it's actually a syndrome which worries. And what is that syndrome? The woman she starts gaining weight, she starts getting acne, she starts getting hirsutism, and then her periods start getting irregular, and then the infertility problems start. So here you have to have the treatment based on whether she is really concerned about her fertility, is she concerned about her weight, about her hair growth, whatever, or her periods alone.
So at least we need to get it checked up too as well.
Yeah,
So for all those women who are
exactly.
gaining weight or probably even if they are dieting, please get it checked up as well. And even for men, when we used to go to the gym, the first thing they say is you'll get your thyroid checked up. So it's good to go to the doctor every now and then.
absolutely no. Regular checkups, we've been promoting that, and you tell us at least every 6 months to a year one should do a full body check. But now, I don't know, I'm just so confused with all this information. I feel like, we don't really know anything what's happening within our bodies. But let's move on now, because all of these things they sound very scary and they sound very severe, but you also have another infection, which is others going to talk.
UTI, and it's very common too as well. Is it because of unhygienic practices, or is it natural, or is it because of the food we intake?
UTI, actually, young girls who are unmarried, it's really not really very common.
Okay.
It does happen in some of the girls where the reflux of the urine occurs in the ureters. Normally, the bladder, pushes the urine out, but sometimes it goes up as well. So, in that particular case, they are liable to have it. But otherwise, UTI is more a disease of, a married woman. And
can husbands be a cause of that too as well?
yes, very much.
Okay.
So that is why, we should also keep in mind that the girls who have recently got married, they do get it, and they have to take plenty of water, and
that's not
then
just-
they have to get it investigated, because it leads to, if you don't treat it at low level, it goes up to the kidneys sometimes.
Okay, exactly. And the thing is, it may be, more prone to one, but it does happen with everyone, because it can be, not using the bathroom properly. It could be not enough fluids and all of this. Is that,
Well,
does this,
this is more of a myth attached
myth,
with it,
right,
rather
okay.
than actually, so mainly it's the sexual life which is actually responsible, and pregnancy per se. In the pregnancy, sometimes, in fact, most of the time, it's the hormones which are delaying the output. So the best solution to the prevention of UTI is more water.
And the husbands need to be careful too about it. as
and
well.
then obviously the STI
One
needs
last
to be
thing very
controlled.
quickly before we wrap up the segment, that is that I've seen that there has been an increase in the use of contraceptive pills. How do you think that these contraceptive pills in excess, if you use them, can damage your health?
For about 3 years, the contraceptive pills are absolutely safe.
Okay.
Provided you don't have additional risk factor, which needs to be, and everyone has to look into before prescribing contraceptive pills. They're an absolutely good anti-pregnancy drug, which is we cannot discourage it. And but the important thing is, more than 3 years, it starts affecting the genital tract to some extent. So one has to get the regular pap smears and all that thing. But otherwise, it's one of the the contraceptives which we cannot
it's safe.
discourage. It's safe, and especially
But not more
the
than
low
3
dose.
years.
The low dose formulations have to be
I
chosen.
think over here, I think it's dangerous to make any kind of overall, general comments here, because
Yes,
each depends on your physician and depends
Exactly.
on your biology and pathology, right, and
Exactly.
everything. And also with all that research that is going on there, some can trigger, they say some can trigger cancers, some can be preventative. So it's a whole
Excess
research.
of anything is dangerous.
Yeah, not knowing, without going into the experts. But thank you so much for being here
Thank you
today. It's
very
been an
much.
absolute pleasure to discuss all these potential issues that women and men can go through as well. Thank you so
Thank you
much
so
for your
much.
time.
Thank you very much
Thank
for
you very
being with
much.
us. But before we go head towards the break or towards the other segment, ladies and gentlemen, over here in Pakistan, we have this common practice of dealing with our issues by our own selves. We become our own doctors. We prescribe ourselves our own antibiotics too as well. Please don't do that. just take out like half an hour, go to the doctor, get yourself checked up every now and then, because we just love you and everybody else loves you too.
Exactly, and like Shazad said, the more we put it off, the bigger the issue can become. And when it can be preventative or curable, we may push it to a point where there's anything can be done. We're putting ourselves in through unnecessary pain. But now we're going to go for a short break, and when you come back, we're going to be discussing another thing that affects all of our lives as well.
And it is very important too.
Very important.
Stay tuned. Good morning.
The Faisal Mosque is the largest mosque in Pakistan. Located in the national capital city of Islamabad. Completed in 1986, it was designed by Turkish architect Vedat Daloki to be shaped like a desert Bedouin's tent. It is situated at the north end of Faisal Avenue, putting it at the northernmost end of the city and the foot of the Margala Hills, the westernmost foothills of the Himalayas. It is located on an elevated area of land against a picturesque backdrop of the Margala Hills. This enviable location represents the mosque's great importance and allows it to be seen from miles around, day and night. The Faisal Mosque is conceived as the national mosque of Pakistan and is named after the late King Faisal bin Abdulaziz of Saudi Arabia, who supported and financed the project. It is the largest mosque in South Asia and one of the largest mosques in the world. The Faisal Mosque was the largest mosque in the world from 1986 until 1993, when it was overtaken in size upon the completion of the Hassan II Mosque in Casablanca, Morocco. Subsequent expansions of the Masjid al-Haram, the Grand Mosque of Mecca, and the Masjid al-Nabwi, the Prophet's Mosque in Medina, Saudi Arabia during the 1990s, relegated Faisal Mosque to 4th place in terms of size. Architectural wonders of Pakistan.
Shazad, we're starting. Welcome back, everyone. And Shazad is trying to prove a point. Stop it. You're distracting me now. So Shazad.
I was just looking at you.
Yeah,
What's wrong in it?
That's not looking. That's called staring, and that's uncomfortable, Shazad.
I'm sorry for that.
It's okay. It's
And
quite
it
right.
is really, ladies and gentlemen, and this is what we're going to talk about. So we are going to talk about an anti-ogling campaign.
Yes.
And it was a great initiative. We have been joined by the people who actually initiated. But first, I think we need to take a look at this video.
We do need to take a look at the video, and then we will introduce to our guests. But this is one thing we wanted to highlight, that it's awkward. People behind the scenes, people in front of the scenes. It's not an comfortable environment to be around, be it a man or a female. we're not bashing on one gender or the other, but these are issues that women and men face on a day-to-day basis, especially women within this country. So let's take a look at that video Shazad just mentioned. And then when
The journalist decided to launch an anti-ogling campaign to raise awareness on the issue.
In our country, we put these kind of issues under the carpet. We don't discuss them. That's the reason. And now we are discussing it openly. We are getting a mixed feedback. Good people are coming in as well, encouraging us.
I feel the moment a girl steps out of her house, the men's eyes start following her.
For now, many men here don't even realize there is a problem at all, something these women hope to change, one slogan at a time.
All right, ladies and gentlemen, so, this sentiment or by men saying that, this is a part of our nature actually shows that this is not really a part of your nature. This is how you were brought up. This is how you were nurtured, and nobody around you told you that this is not a good habit.
Exactly, because, as we mentioned already, and as in the reports as well, is that, it happens, people have got to the point where they're just ignoring it. But the thing is, I was kind of thinking about this when we realized we were going to be doing this show, is that, why do we stare when it's, when we've been told, especially for men, to lower their gaze, to respect women? Why do we stare and harass the ones that are going out on the street? And I realized culturally, we've created this environment that decent girls or decent kids stay at home. So therefore, the ones that are automatically stepping out are indecent. Therefore, you are treating like this. So, it's this weird kind of knock-on effect that we're judging someone, but we shouldn't be judging them, and then we're making their environment uncomfortable without actually knowing who they are or what their background is.
And even Maha, at the same time, what I would love to add over here, for example, now we have seen this change in the trend that now women are working, they're stepping out too as well. And even within the offices, I've seen that people, when they talk to women, they just don't look at their faces. So when you talk to somebody, you're supposed to look at their faces. That's what it is.
Absolutely. So to discuss all of this, and the lady who started this campaign on Power 99, which is very important, we've been joined by Aneela Ansari. She is our communications expert. She's a journalist and a radio activist. She's also worked in crisis intervention for gender issues in UK and in Pakistan. Assalamu alaikum. Good morning.
Walaikum salam.
Thank you
Good
so much
morning.
for joining us today.
Thank you for inviting me, ma'am.
And besides Miss Aneela, we have been joined by somebody who's the member of campaign and a member of team as well. She's a radio journalist. She's none other than Miss Sidra Waqar. Hello, assalamu alaikum.
Hello, assalamu alaikum.
Wa alaikum salam. Thank you very much for joining us. So let's get the conversation started.
Yes.
Why do you think there was a need for such a campaign when we can just educate people by telling them at our houses that we are not supposed to do that?
So Pakistan came into being about 70 years ago, and I guess we failed miserably at educating people in the houses, and therefore I felt the need for this sort of behavioral change campaign.
Okay.
I'd lived in the UK for over 20 years, and when I returned to Pakistan 2.5 years ago, everywhere I went, I could feel these eyes following me, public transport, offices, shopping centers, and people looking at you, really badly, staring. So I decided, because I'm a trained journalist as well, and in the UK, a lot of my work was around behavioral change. So some of my friends who I worked with when I was in Pakistan and I worked for a newspaper, I spoke with them and I said, we really need to do something about it.
Okay.
And that's how this idea was born. Through a personal experience. I mean, you land at the airport and that's where it all begins.
Yeah.
And so I discussed with my friends who own a FM radio station in Islamabad, and they really liked the idea, and they said, you have our platform to launch your campaign. So I designed this anti-ogling campaign to address the issue of female harassment, especially in public spaces.
Okay, wonderful, and that's that's so wonderful that
Great initiative.
It is a great initiative. So Sidra, within Pakistan, as you've mentioned, and we saw in the report as well, and what we were discussing, that people they've got to the point where they ignore it, or they're told to forget about it, or don't pay it any attention.
Or they tell their daughters to stay back at home.
Or stay back at home. So what is actually going on out there?
Yeah, you have mentioned a very serious thing, because we don't communicate in our families, because it's a kind of prohibited. It's like a taboo that talking about issues like that to your even mother, it's very serious. And they can, because we have a fear as a girl, we think that they will stop.
Yeah, there will be serious implications on
Yes,
you then.
they will stop our education, stop making us going out, and so many other things.
Okay.
All right, and you know, there's one more thing which I would love to add over here, and that is that we over here in Islamabad, in fact, in entire Pakistan, have this culture of having security guards outside the house, you know, cleaners and whatnot, and they sit all day. So everybody who's going in and out of the house, they're just looking at them. And quite a lot of times, me and my father have actually stepped up, went to them and told them that, you know, you're not supposed to do that. But they just can't get rid of this habit. So what do we do then?
So what kind of campaign did you design, you know, for, you know, because it was for the audience of Pakistan. So how do we reach them without kind of getting everyone like, oh, no, 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 you know, not every guy is like this, and this guilt?
Absolutely. There are a few male members in our team as well who obviously support our campaign. Like you mentioned earlier, we're not targeting one particular gender, but unfortunately, it is harassment is perpetrated mostly by men.
Yeah.
Statistics show that as well. And here I would like to make a distinction between looking and staring and ogling. To look is fine. I mean, I don't mind if a man looks at me and then looks away. This is human nature. You would look at people. But ogling is like, you know, continuously staring at people and making them feel uncomfortable.
Okay.
Harassment is a range of behaviors that can make you feel uncomfortable, can make you feel anxious and disturbed. So obviously, it's invasion of your personal space. Like, you wouldn't like a stranger barging into your house because that's your personal space.
Yeah.
The same way, you wouldn't feel comfortable if strangers, you know, were constantly staring at you.
Okay.
So the campaign has several components. We've put together some activities as well. So we do a radio show every month, a 2-hour radio show where we take live callers and we discuss several issues. We chose ogling as a subject for our campaign because ogling, I think you won't come across a single woman in Pakistan who can confidently say she's never been ogled at.
Okay.
So ogling is at the bottom end of this. It's a spectrum, isn't it? Harassment, and at the serious end is assault and rape, and you know.
Exactly, and we'll definitely come back to this as well, and
Yes,
we'll discuss different solutions. But for all those Taru people who are out there, we have a song for you guys by Ali Gulpir, and the name is Taru Maru. Go ahead, take a listen, Taru people.
ऐ ज़माने वालों मैं हूँ ताड़ू ताड़ ताड़ के देखूं मैं हूँ वो मानो भले सातों बॉयफ्रेंड या हो मामू मैं तुझ पर चलाऊं अपनी नजरों का जादू लफ्जों की ना जरूरत करूं आंखों से बात इसका मतलब you're very hard मेरे सामने होते हो तुम रोज अब भूखे के सामने कोरमा खाते हो सब मैंने करने दूंगा किसको ज़ारे प्यार अबे क्या कर रहा है मेरी बहन है यार ताड़ू मारू नहीं करने दूंगा प्यार ताड़ू मारू सबको करूंगा ख्वार ताड़ू मारू जब तक पड़ती नहीं मार मैं इसको ताड़ू उसको ताड़ू सबको ताड़ू ताड़ू मारू नहीं करने दूंगा प्यार ताड़ू मारू सबको करूंगा ख्वार ताड़ू मारू जब तक पड़ती नहीं मार मैं इसको ताड़ू उसको ताड़ू सबको ताड़ू
Welcome back, everyone, and that was the track for you. You know, you're supposed to listen to the lyrics, you're meant to try and take something away from it. But Aneela, because you know, it's a very important topic and we're running short of time, but you know, the campaign, you guys decided to start it on radio. You know, you've already discussed that it's a massive medium here, you're reaching the masses. But what are the other objectives behind this campaign, rather than just to highlight that this is something that's very uncomfortable happening within our society?
So the main object of our campaign is to bring a positive behavioral change amongst male behaviors. We want to target male behaviors. We want men to acknowledge that this is what they do. It impacts on a woman's mental health and well-being, her employment, and her educational opportunities, and we want them to start making positive behavioral change. At the same time, we want women to become more confident in challenging these behaviors and create safe spaces for women to go out where they don't feel threatened or intimidated.
Amazing.
Wonderful.
So, Sidra, what solutions did you come up with?
Yeah, as I agree with Aneela that making places safe for women, girls, because we go out, we use public transport. At workplace, we come across so much this ogling and harassment, other forms of harassment. So the purpose of the campaign is that the behavior change in men, and because when we started this campaign, we have come across with so many different kind of feedback, that women dress up like this, they do makeup, and they try to attract us, so that's why we ogle them, and these things should be omitted, deleted, and our biggest change in our thinking should be there.
Wonderful.
Wow.
Thank you so much. And I just want to highlight there's a few things, within the reports and within what our conversations, that men say, oh, it's our nature, and then women are dressed up. Now, this is not an excuse, because even women who are completely covered from head to toe, they are being ogled and stared at, to the point where it is not just staring or just looking, it is, you are harassing their personal space. And it's about an individual. You cannot keep blaming the female for every ill or every wrong in society, and I need to relax myself and not get worked up about it, because it really agitates me.
Yeah, but I think I'm going to second Aneela over here, because she said that looking at somebody is very natural. When you look at someone, that's fine. But ogling or staring definitely does. It comes under harassment, ladies and gentlemen. So we really need to be clear about that. And other than Pakistan, in other countries, there are laws where you can go and sue people about this as well. But over
There's
here,
accountability.
unfortunately, we just have to tell people right now that, please do not do that.
Exactly. Teach it to our brothers, teach it to our sons, teach it to our fathers, teach it to anyone around you. But thank you so much for being here. I'm sorry we didn't get more time, but we'll definitely keep promoting this campaign, because it's very important.
And do check them out on Facebook as
Yes.
well. It's the anti-ogling campaign. So please make sure that you like it and share their content.
And we'll be sharing any information that you would like to know about anything we've discussed about today, and any of the medical issues that we also talked about, because there are a lot of conversations and different opinions about it. So we give you one angle, that doesn't mean that's the whole angle. So with that, log on to our Facebook fan
Which is
page,
with the name of World This Morning.
our Twitter page,
World This Morning without a G.
our Daily Motion YouTube
World
page.
This Morning, World This
And
Morning.
the repeat is that.
11 p.m.
Have a wonderful day, and we will see you bright and early very soon.
Till the next time, 1, 2, 3, good
Good morning.
morning. Thank you.